Okay, guys, good afternoon, everyone. So, today we are going to continue our discussion with the drugs that are used to or used for the nervous system. Now we have the central nervous system stimulants and the central nervous system depressants. So we start out with a comparison between the two. Depressants slow messages between the body and brain. They also signal or even signals from the eyes and other senses reach the brain slowly if you give depressants to a patient. The heart rate drops, leaving the body with less energizing oxygen, so it has an influence on the heart rate. The respiratory rate also decreases. That's why there's a less risk of lung infection. Messages to muscles are also slower, so arms and legs can't move well when given CNS depressant. And the result is the body can sense or respond to danger quickly. While stimulants, they create fake messages in the brain telling the body that it is under stress. So it's as though that the body is undergoing a flight or flight situation. So blood to the skin decreases. The body is less able to cool itself. That's why overheating is a risk when we take stimulants. Opposite of that of the depressants, the heart rate increases. So it speeds up. Blood vessels also to the heart constrict. The liver also will release sugar into the blood, reducing the body's energy stores. So result is if real stress occur, the body won't be able to respond. Now we start with the CNS stimulants. These are drugs that can stimulate our central nervous system, and they are medically approved. So they are medically approved, and these drugs are used to treat attention deficit hyperactivity disorder. This is a condition in children during school age wherein the child lacks or the child has the three cardinal signs of ADHD. What are they? It's IHI, Hihi, IHI. Inattention or lack of attention, hyperactivity, and impulsivity. So they're very impulsive with their behavior. There's narcolepsy. Narcolepsy is a condition where the patient suddenly falls asleep in the middle of the day while doing their job, while in class, for example. That's narcolepsy. Those who have obesity as well, because stimulants can suppress the appetite of a patient and also cause weight loss. And those who are undergoing respiratory distress. Now, these drugs can calm hyperkinetic children and help them focus on one activity for a longer period. That's why these drugs are given to children with ADHD. In addition, they redirect and excite arousal stimuli from the reticular activating system. Remember, our RAS or RAS is responsible for our sleep wake cycle. And the CNS stimulants, they are keeping us awake. That's why it's given to patients who have narcolepsy. So they are constantly awake during the day and they won't fall asleep. So majority of the CNS stimulants are controlled substances, so it is important for patients to be taught how to secure them to prevent inappropriate use and distribution. So these are controlled substances, meaning you need to have a prescription in order for you to buy it, and they are highly addictive as well. Therapeutic action. They act as both cortical and reticular activating system stimulants, possibly by increasing catecholamine release from the presynaptic neurons. And these CNS stimulants, they are able to increase stimulation of the postsynaptic neurons. That's what they do. They increase the catecholamines in the presynaptic neurons. What are the catecholamines? If you recall your anatomy and physiology, catecholamines are neurotransmitters like epinephrine and norepinephrine. So if they are constantly released at the presynaptic neuron, especially at the RAS and the cortex, the patient will be constantly be alert, constantly stimulated. But these drugs, they have a different effect for children who have ADHD. It's the opposite. If it keeps us normal people awake, it has the opposite effect in children. It has a paradox in children. There is a paradoxical calming effect of these drugs in hyperkinetic children, which is thought to be related to the increased stimulation of the immature RAS. It is believed in a theory that children who have ADHD have immature reticular activating system. That's why they are not able to focus. And these drugs help them focus, help them calm or be calm. So once these drugs are given, there's also an ability for them to be more selective in response to the coming stimuli. So they will be more focused, more attentive once we give children with ADHD these drugs. So indications for the treatment of ADHD and narcolepsy, together with the few ones I've mentioned earlier, like obesity and respiratory distress. For children, cautions should be used with extended release preparations because they differ markedly in timing and effectiveness. So we need to teach parents with regards to the timing and dosage of the drugs. CNS stimulants in children are often indicated for the management of ADD or ADHD, and children should be assessed carefully and challenged periodically for the necessity of continuing the drug. So, psychiatrists or developmental pediatricians will need to assess children every now and then if they still need these drugs or not. Because if they're no longer exhibiting signs and symptoms of ADHD after discontinuing the drug, then it's better not to give these drugs anymore since perhaps they already have been treated or what. So it needs to be discontinued. Adults, usage of these drugs in the population requires close monitoring for adverse effects. And it can be highly addictive in adults as well, especially those who have narcolepsy. Cautious use of these drugs for older adults are required because this population is more susceptible to drug adverse effects, most especially the elderly. We need to use this cautiously to the elderly. And it is important to note that these drugs are not used to control behavior with dementia. So, pharmacokinetics for the oral route, the onset varies. Peak is around 1 to 3 hours, and the duration is 46 hours. The half life of these drugs are around 1 to 3 hours. It is metabolized in the liver and excreted by the kidneys, of course. Contraindications and cautions for those who have allergies to CNS stimulants. We need to prevent hypersensitivity reactions by offering them with antihistamines. And usually, if patients take this, they can experience marked anxiety, agitation, tension, and severe fatigue, glaucoma in some cases. Glaucoma is where they can only see, or they have tunnel vision. They can no longer see their peripheral vision. That's glaucoma. And these conditions can be exacerbated by CNS stimulation caused by these drugs. And for those who have cardiac disease and hypertension, they can be aggravated by the stimulatory effects of these drugs. So, we need to advise patients who have cardiac disease and hypertension to not take these drugs because it will further aggravate, it will further worsen their condition. Those who have history of seizures, they can be potentiated by CNS stimulation. So it's very, very important to ask the history of the patient, health history. Just in case they have seizures, we are not going to give these drugs. Or history of drug dependence, including alcoholism, because drugs may result in physical and psychological dependence. Like what I've said earlier, they are highly addicting. And those mothers who are pregnant and lactating, because potential adverse effects on the fetus or neonate can occur. So we need to withhold this drug for mothers who are pregnant or for mothers who are breastfeeding. Adverse effects for the CNS, there's nervousness, insomnia, dizziness, headache, blurred vision, difficulty with accommodation. So that's with the eyes as well. Cardiovascular, there's hypertension, arrhythmias, and angina. Angina is chest pain, most especially the left side of the chest. For the GI, there's loss of appetite or anorexia, nausea, and weight loss. That's why this is also intended for patients who have obesity or who are obese. Skin rashes are a common reaction, and this can cause physical and psychological dependence. These drugs, they have the same molecular structure of methamphetamine. If you know that illegal drug, commonly known here in the Philippines as shabu, it's known as crack or crystal in the United States. It almost has the same molecular makeup. That's why it's addictive. We need to note also drug to drug interactions of these drugs, such as monoamine oxidase inhibitors. If you mix them with MAOIs, there's an increased risk of adverse effects and increased toxicity. If you mix it with an antihypertensive, guanethidine, there will be a decrease in antihypertensive effects of these drugs. For tricyclic antidepressants or TCAs and an anticonvulsant phenytoin, it will increase their drug level, so it's okay. Nursing responsibilities for giving these drugs is to arrange to interrupt the drug periodically in children to determine whether the symptoms recur and therapy should be continued. Because if, like what I've said earlier, if the child no longer presents any signs and symptoms of ADHD, this needs to be stopped. So we need to check further if the signs and symptoms are present in children. Arrange to dispense the least amount of drug possible to minimize the risk of overdose and abuse since they are addictive. Administer drug before 6 p.m. because these drugs, since they are stimulants, they can cause insomnia. Remember, Shabu, they cause insomnia. They won't let the person sleep. That's why patients who are persons who are addicted to Shabu, they either have no sleep and they appear very thin because it can cause weight loss. Monitor the patient's weight as well. Monitor CBC or complete blood count together with the electrocardiography, which is the electrical activity of the heart, to ensure early detection of adverse effects and proper intervention. Provide safety measures by giving adequate lighting. Raise the side rails if they feel restless, and in order also to prevent injury from happening. Educate the client on drug therapy to promote understanding and compliance. That's why we need to teach these things to the patient, most especially when to take the drug and what are they going to avoid while taking the drug. So examples of the CNS stimulants are the following. We have amphetamines, amphetamine-like drugs, anorection, analeptic, respiratory CNS stimulant, ergot alkaloids, and selective serotonin receptor agonists. So we start first with the amphetamines. We have amphetamine Adderall, dextroamphetamine, dexedrine, methamphetamine, dexosin, and their indications are for ADHD and narcolepsy. Contraindications and cautions, those who have symptomatic cardiovascular disease, most especially if they have angina pectoris, for example, coronary artery disease. If they also have hyperthyroidism, excessive production of the thyroid hormones. Remember, in hyperthyroidism, their vital signs are already increased. It will be further increased if we give these drugs to the patient. Or those who have or are in agitated states. During the stress response, we need to stop this from, we need to stop giving these things from the patient or for the patient. Those who have a history of drug abuse as well, we need to withhold these drugs, especially those who have abused methamphetamines before. Okay, adverse reactions of amphetamine, we have dry mouth, anorexia, weight loss, diarrhea, constipation, and impotence. Other side effects, There, erectile dysfunction or impotence in males, insomnia, of course, because these are stimulants, or there is increased sex drive for some males, since they are stimulants. Visual problems can occur, headaches, weight loss, of course, dizziness, and increase in blood pressure. Nursing responsibilities, monitor the vital signs, which is very, very important because you need to monitor the heart rate and the respiratory rate of the patient and the BP as well. Monitor the weight, since there's weight loss. Offer fluids. Provide reassurance, most especially if the patient is restless. Report extreme restlessness and insomnia. Monitor for withdrawal. Of course, if they are already receiving stimulants, avoid giving the patients caffeinated beverages, such as coffee. And provide alternative therapies for sleep. Because patients who have insomnia brought about by this drug are not able to sleep, we need to help them sleep by offering massage, by offering guided imagery, and other things. Now we go to amphetamine-like drugs. We have methylphenidate, Ritalin, atomoxetine, Strattera, and modafinil, Provigil. Action produce CNS and respiratory stimulation with weak sympathomimetic activity. Contraindication caution, same as before, like amphetamine drugs, since those who have a hyperexcitable states as well, contraindicated. Uh, they, they are contraindicated from these drugs. So these drugs they are also used to treat ADHD. Adverse effect almost same as that of the previous one. There may be sudden death as well. So it's almost the same thing as that of the previous one. Nursing responsibilities. Monitor the patient's vital signs again. Monitor the length of time being treated. Teach patients about diet management since this can cause anorexia. So you need to offer small frequent feedings to patients and encourage exercise. Now we go to analeptics. We have caffeine and theophylline. So coffee can also be a drug. So it affects the brainstem, the spinal cord, and the cerebral cortex. It relaxes the bronchial smooth muscles, increases heart rate and blood pressure, and stimulates respirations. So these drugs they can also be given to patients who are experiencing asthma. Aside from that, for newborns who are experiencing apnea as well, since they relax the bronchial smooth muscles. That's why one of its side effects is palpitation because it increases the heart rate. Contraindications and cautions, those who have seizure disorders, same as before. Those also have cardiovascular disease and impaired hepatic and renal function. So we need to check the history first if they have liver or kidney problems before administering this drug. Adverse reaction, it's almost the same as that of before, but there's twitching. So muscle twitching, you can see their face doing this. Diuresis, which is increase in urination. I'm a caffeine addict. That's why I take 45, not even cups, mugs of brewed coffee per day. That's why I always go to the toilet to urinate. So there's increased urination with analeptics, tinnitus, which is very rare. There's psychological dependence and necrotizing enterocolitis, wherein there will be death of the intestinal tissue. It is very, very rare, but it can be deadly. So you need to watch out for that. Nursing responsibilities. Again, we need to teach the patient not to take it before bedtime because they will or they cannot sleep. Check the cardiac rhythm and increase urine output since they are increasing the heart rate and they increase the urine output as well, and assess for sleeplessness. If they have insomnia, we need to assess them with regards to sleep. Next, we have respiratory CNS stimulants like doxapram or dopram. A low dose of this drug stimulates the carotid receptors, while a higher dose of the drug stimulates the respiratory center in the medulla, which produces generalized CNS stimulation. So, what does it do? It is indicated for patients with respiratory depression or those who have undergone narcotic overdose because narcotic analgesics can cause respiratory depression. Although mechanical ventilation is more effective to treat narcotic overdose. Note, Narcan or naloxone is more specifically used for opiates or narcotics since they are used to treat narcotic overdose as well. Aside from that, they are used as a pre or post anesthesia medication and those who have COPD or chronic obstructive pulmonary disease. Contraindications and cautions. Those who have head trauma, we are not going to give this drug. Seizures as well. Those who have severe respiratory illness, such as acute asthma, or those who have mechanical ventilation, those who have flail chest, and those who are experiencing pulmonary embolism. So, though we are not going to give these drugs to those patients who are experiencing these things, and they are cautiously used for neonatal apnea as well. Adverse reactions and side effects of the respiratory CNS stimulants. There can be hypertension associated here, together with tachycardia, seizures. That's why it's very, very important to ask the patient if there's a history of seizures. Phlebitis can occur or inflammation of a vein can occur at the IV site. So we need to check out for that. And laryngospasm, it's very rare, but it's deadly. If the patient is experiencing spasms of the larynx, this can obstruct their airway. So if that happens, airway is obstructed, they might die from respiratory arrest. So nursing responsibilities, we are going to monitor again the vital signs, especially the respirations of the patient. Monitor for signs of overdose. That's why it's very, very important to monitor the RR or respiratory rate of the patient. Check the IV site if there is phlebitis, if there's swelling. And instruct patient to notify the doctor immediately if their respiratory problems worsen because that can be dangerous. It can lead to respiratory arrest. Now we go to migraine headaches. Migraine headaches is more common in women than in men. And the sign and symptoms of this is unilateral throbbing, usually temporal. So you can feel throbbing. There is nausea and vomiting associated with this, together with photophobia. You feel irritated by bright lights, and together with vertigo, wherein your environment spins around you. You're already experiencing headache, the same time you have vertigo, which can worsen the patient's condition. So this is caused by inflammation and dilation of the cranial blood vessels. So there's dilation later on, there's constriction, which precedes the migraine, which is a blow out of the vessel. So there's alternating between dilation and constriction. That's why there's throbbing sensations felt on the temples of the patient. So preventive treatment. To prevent vasoconstriction for migraine, we need to administer beta blockers such as propranolol, Inderal, and atenolol. These are drugs ending in olol. You'll learn more about these drugs later on when we talk about cardiovascular drugs. Anticonvulsants such as gabapentin, Neurontin, topiramate, Topamax, valproic acid, Depakote can be given. And tricyclic antidepressants such as amitriptyline, Elavil, and imipramine, topramin, or toframinil rather, are also given to allay the signs and symptoms of migraine. Now, treatment for cessation in order to stop migraine headaches to occur. Analgesics for both migraine and cluster headaches. We can either give opioids, NSAIDs, or a combination of both. Remember, opioids, we still need the prescription in order to buy them. Unlike that of NSAIDs, NSAIDs are commonly over the counter. So sometimes they are given in combination, hydrocodone with ibuprofen. Ergot alkaloids are also given, like ertotamine tartrate or ergostat. Action of this is it vasoconstricts the cerebral blood vessels as well. Now we go to the triptans, drugs ending in triptan, the selective serotonin receptor agonists. We have sumatriptan, imitrex, zolmitriptan, zomig, and elatriptan, relpax. They are again for migraine and cluster headaches, and it's best given via subcutaneous. That's the most effective one. Or it can be given orally per orum or nasal sprays. Action, they vasoconstrict dilated cerebral blood vessels. Because based on the pathophysiology of migraine, the blood vessels are dilated. Contraindications to those who have severe hypertension and heart disease. Adverse effects. You check for injection site reactions, paresthesias, so tingling sensations of the extremities. In Tagalog, ito yung nakukuryente, yung mga paa at kamay. We are experiencing that sometimes. Hot or cold sensation may be felt by the patient. Malayan fatigue, so they will be they might be feeling weakness. Chest pain can occur together with dizziness, flushing, so their face will appear red because of vasodilation. Peripheral vascular ischemia can occur because of the increased blood flow to the head. Loss of vision, and the worst case would be MI and cardiac arrest, most especially if the patient has cardiovascular disorders. That's why it's very, very important in the nursing responsibility to check the patient's history. If they have any cardiovascular disease, because that can lead to MI or cardiac arrest. Discuss the side effects as well to the patient and monitor for extreme adverse effects. Now we go to the CNS depressants. They can cause varying degrees of depression, which is a reduction in functional activity. Broad classification of CNS depressants are the following. We have sedative hypnotics. We've already discussed them before. Those ending in am, pam, 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 these are anxiolytics, drugs that are used to treat anxiety disorders. General anesthetics and local anesthetics, narcotic and non-narcotic analgesics, anticonvulsants. Numbers 3 and 4, I'm going to discuss them at a separate lecture. Antipsychotics and antidepressants have already been discussed previously. So this, again, they cause sedation, sleep, and unconsciousness. That's why we are going to cautiously give sedative hypnotics to patients. Warn them not to drive or operate heavy machinery because these are drugs under sedative hypnotics are drugs that are namely benzodiazepines or and Z drugs, barbiturates, and melatonin agonists. We've already discussed these things before. Contraindication, those individuals who have sleep apnea syndrome or severe respiratory insufficiency, those who have acute narrow angle glaucoma because it will worsen their condition, their disease. Remember, glaucoma, they can only see or their vision is only limited to the center. There's tunnel vision. Their peripheral vision is blinded. Also, contraindicated to pregnant women. Side effects, it's as though the patient has a hangover. That's why we're not going to give this drug together with alcohol as well. There is rapid eye movement rebound. Dependence intolerance can occur because they can be addicting. Excessive depression can be felt by the patient. Respiratory depression, that's why we need to watch out for the patient's respiratory rate. Hypersensitivity can occur, but it's not common. Nursing responsibilities, we've already discussed these things before with regards to anxiolytics or sedative hypnotics. It's best given at bedtime in order for them to sleep. Nutrition, food plate should be followed or balanced diet, fluid intake, vitamin use, and avoid giving heavy meals late in the evening. Alcohol and caffeine consumption should be reduced or discontinued in order for patients to sleep. Introduce decaffeinated or herbal products instead. So instead of offering coffee, offer them green tea or decaffeinated coffee. Dairy and soy products are encouraged. If they want to sleep, position them in a comfortable position that the patient wants. And offer back rub. Patients should empty their bladder prior to sleep and calm down the fears of the patient. And for the patient to properly sleep, offer a quiet and darkened room. There should be less distraction, no TV before bedtime, adequate ventilation, of course, subdued lighting, or there's a dim light in the patient's room. Correct temperature as well, because if it's too hot or too cold, the patient's not going to sleep. Control the traffic if the patient is admitted at the hospital. So avoid going in and out of the patient's room at nighttime. Limit your patient visits at night, and offer night light if the patient wants a night light. Activity and exercise should be included in their activities of daily living. Stress management as well. So if they need counseling, offer counseling services. Relaxation techniques by doing deep breathing exercises, or what else? Guided imagery, for example. Refer them for mastery of biofeedback. Meditation can be done like in yoga. Express, encourage expression of feelings as well. Let the patient talk. And channeling toward positive, realistic goals. Set realistic goals for these patients. Fostering health maintenance. Discuss the medications, their side effects, their benefits, and stress non pharmacologic interventions as well. Like, for example, for them to properly sleep, do those following things: not to watch TV, not to take coffee, and others that I've explained earlier. They should also have compliance to their drug regimen. And we need to provide information to their significant other, to their partner or their spouse, regarding the adverse and serious adverse effects of the drugs. Written record, they should monitor the drug that they are taking every day. So there are monitoring parameters in order for us to assess their level of understanding. Anesthetics. These are diverse group of drugs that are used in the management of pain and are drugs that are used to cause complete or partial loss of sensation. What are they used for? They are primarily used in order to cause anesthesia to patients who are going to have an operation, or those who will be undergoing a surgery, either minor or major surgery. We have two classification of anesthetics: general anesthetics, which depresses the CNS, they alleviate pain and cause loss of consciousness. General anesthetics are given to patients who will undergo major operations. Major operation, like they will be operated on the lungs and heart, the brain, the abdomen. The doctor, the surgeon will coordinate with the anesthesiologist. So the anesthesiologist and the surgeon will work hand in hand in the operation of the patient. So once general anesthetics, they are usually given through inhalation. So it's inhaled, or through IV. It's given through IV. Well, local anesthetics, they block pain at the site where the drug is administered. So let's say, for example, the patient is going to have an incision and drainage of a boil here on the arm or the shoulder. There's no need for general anesthesia. They are just going to inject an anesthetic here in order to numb this area, in order for the doctor or the surgeon to drain the pus from that boil. Or let's say, for example, you have a cut on your arm. Here, you accidentally cut yourself, and they are going to stitch it up. They need to inject an anesthesia, local anesthetic, in order to numb this area. There's no need for general anesthesia for a minor surgery like suturing, or like for circumcision as well. It will block the pain at the site where the drug is administered. You are going to learn more about anesthetics once you're already in your third years at in your medical surgical nursing. That is what I am currently teaching my third years right now during their peri-operative nursing. I have currently taught that concept about anesthesia. You will learn more about this once you're already in third year. So that's it, guys. That's our topic for CNS stimulants and CNS depressants. So if you have any questions about our lecture for today, please do not hesitate to ask me all about them. I would be more than glad to answer these questions for you. Again, thank you very much for attending today's lecture for pharma. Have a great day and good luck on your upcoming exams. Bye.